Yep. It's live, so shall we start?
Yeah.
Okay, so good morning, everyone. And yes, it's not a Sunday yet, but we have a very special guest today with us. So I'm here to introduce her. I'm not going to speak about her on a personal. Yes, but one thing, of course, I want to mention that she is when I met her, I mean, or whatever time we have interacted, she is a very lively, chirpy, full of life, vibrant, vivacious, positive person. You know, you'll see her smiling all the time. And she has this thing that if she's smiling, you'll see the people who are around us, they also have that smile. And, you know, that thing passes on to others. And for those who are not aware, she's Nupur Man's daughter. So you know how like other things. You can simple line you can say like mother, like doctor. So this was about Krishanga. Let's talk about Dr. Krishanga. So Dr. Krishanga, I mean, she still looks like a kid to me, but yes, she is a doctor. She has completed her bachelor's degree in dental surgery and is currently practicing with a renowned corporate chain of dental clinics. Okay, so Krishanga believes in providing information to people and creating awareness. She believes in improving the access to healthcare by empowering communities, medical professionals, and patients. With her passion in writing on the platform Medindia, it has become a medium for spreading information and for providing information to others and spreading awareness. Currently, she's volunteering in two different organizations where she's taking digital classes in Jharkhand and she's also taking classes for students in Jammu and Kashmir and Kargil. She has also interest in wildlife watching and she believes in the cause of animal care and welfare. And today with us, she'll be sharing her view on the topic. Your mouth is the mirror of your body. So, Krishanga, I welcome you, and we are all ears. Please, over to you.
Hi, thank you so much for a beautiful introduction. I mean, it's a lot of things, but yeah, thank you so much. So I won't take much time in thanking. I'll just share my screen. Let me know if it's visible. Because I like, talking through presentations and
yeah, it is visible.
That's what I'm going to do. Okay, so today is World Health Day. And so every year on 7th April, we commemorate it as World Health Day. So the whole point of celebrating World Health Day is to spread awareness, like all the other days, just to spread awareness. But also the idea here is for you to know about your body, for you to know about your health. And through my talk, I'm just going to bring that side of health that is always undermined. So whenever, I ask this question to a lot of people, how many of them actually go and see a dentist? And I'm not surprised also, even I don't go that often, but 90% of them tell me that, okay, when we have a problem, we go and we see a dentist. So, but, things need to change now. Now, the why things need to change is what I'm going to talk about. So, first of all, good morning, everybody. If I did not wish, good morning to one and all. And my topic for today is your mouth is a mirror of your body. So moving on to the topic, there are two things that I'm going to focus on. First is oral manifestations of systemic disease. So what it means is basically the signs and symptoms we are seeing of a disease in our body in the oral cavity or in the mouth. And second is systemic manifestation of oral diseases, which is basically any disease in our body, it shows some kind of sign in the mouth. So the relation between oral health and systemic health, there are 4 pointers to it. The first one is systemic diseases can have oral manifestations. Let's just take an example of one disease. Let's say diabetes. So diabetes is a systemic disease. It happens in our body, but you can have oral manifestation. So in subsequent slides, I will tell how. So just seeing your mouth, I can say, yes, you have diabetes. Then you have treatment of systemic diseases that can affect oral health. So when we're talking about treatment, let's say there's a pregnant woman, and this pregnant woman is prescribed with tetracycline. That's a very common antibiotic drug. So what happens after she delivers her baby is that her baby would have yellow teeth. So this happens very commonly. So that is because of we were treating a disease, a bacterial infection in the body. Baby is having yellow teeth. So this is a teratogenic effect, and this is what happens. Then third is oral diseases can affect treatment of systemic diseases. Now, if you have oral disease, then when you are taking drugs, some of the medicines will not work to its best potency. And the last one is oral diseases can have systemic manifestation. Now, if I have some kind of oral disease, let's say I have ulcer. Now, if I have ulcer, it will pain when I eat. If it's going to pain, I will stop eating, and then I'll have nutritional deficiency. So oral diseases can have systemic manifestations as well. So next question is, so my slides are very question-based slides. So the question here is, can your dentist know if you have systemic disease? Simple answer to it is yes. There are a lot of diseases that we, by just looking in your mouth, can identify. Obviously, we cannot give a proper diagnosis. You need to go undergo tests, but a provisional diagnosis can be provided by your dentist. So let's imagine a scenario. So you are, you're probably brushing your teeth, and then while brushing, you realize that you have a lot of bleeding in your mouth. And this bleeding is not stopping even after 5 minutes, which obviously will alarm anybody because you can't bleed all the time, right? And then you are worried because when you see your mouth, just to examine why it's bleeding, you see your gums are swollen. It's red and swollen. None of these is normal to what you've had before. So you decide to go to a dentist. Now, when you go to a dentist looks into your mouth, completely examines, and says, maybe I think you should, get your sugar tested once. So you take your dentist's advice and you go and get your sugar tested. So when you get your sugar tested, you realize you have diabetes, and not just normal diabetes, like high diabetes. So this is what a dentist looked at. They saw red swollen gums. They saw the tooth was moving. And by just looking at these few signs, they were like, you have diabetes. So the whole point of saying this is that whatever is going in your body can be seen in your mouth. Diseases that are very fatal, diabetes can be very fatal, but is very common. That needs to be diagnosed at correct time. If it is not diagnosed at the right point of time, then it's a problem for your body. Anything can happen. It can even be fatal to your body. So next question is, what conditions can a dentist help you diagnose by just looking into your mouth? So I'm just going to give you a very brief overview of what kind of conditions can a dentist diagnose. So starting with blood disorders. Okay. Now blood disorders, first one, we have anemia. Anemia is when, your RBCs, they reduce in number. So that also we can look into your mouth and find out, because your mouth will not be that reddish. Then we have leukemia. Leukemia, when you have increased number of white blood cells. So white blood cells basically help you in fighting diseases. But these white blood cells that increase in number, they are abnormal. So no matter how many infections come, you will get it because these white blood cells are useless pretty much. So that's leukemia. Then you have thalassemia. Now, thalassemia is when your red blood cells, they change their shape. Now, when your cells change their shape, they become abnormal in function. They don't work to its best potency. Nature is beautiful. It has, our body is beautiful. Everything is very scientific, very mathematical. So even that sphere shape of your RBC is because it gives you the best surface area to carry oxygen and carbon dioxide. So it's very important. So anything changes, your entire body starts changing its function. That starts with very simple symptoms, like you'll be very fatigued and you won't be able to carry out any work properly. You'll become breathless. So all of this happens. And then when you go to a dentist, they tell you, okay, maybe, this is the problem. You should get it tested. It might be too late. But if you were getting your regular checkups, even irrespective of you're going to a dentist or a normal healthcare professional, irrespective of that, if you're getting it done, then you are on the safe side. So next set of diseases that a dentist can diagnose is Crohn's disease, GERD, ulcerative colitis. So when ulcers happen in some places of the intestine, it's Crohn's disease. GERD is basically acid reflux. A lot of people, a lot of patients that I have also seen, they have had acid reflux. And it's very easy to tell. The second you open their mouth, you see their tooth, they're very sensitive, their teeth are very sensitive, and they have a little bit of malformation. Now imagine if you're taking acid and you're putting the teeth in it, obviously, it'll dissolve. Any tooth, if you put in it, it'll dissolve. So that's what happens. Our acids in the stomach are very strong. So they will kind of abrade your teeth and cause sensitivity. Then you have ulcerative colitis. Now the entire one section or the entire intestine can have ulcerations. So here the colon will have ulcerations, which is ulcerative colitis. All of these signs are very much visible in your mouth. And it starts with one basic thing, which is known as halitosis. Basically, foul smell from your mouth. If your breath is very smelly, it's stinky, then you have some gastrointestinal problem, basically some problem in your stomach. Coming to metabolic diseases. Now, metabolic diseases, first thing, major thing is diabetes. Now, diabetes, in fact, the sixth complication, there are 6 complications of diabetes, and the 6th complication of diabetes is periodontitis, which is a dental disease. So it is that important. And diabetes work in 2 ways. It's basically double sword. So diabetes can cause dental diseases, and dental diseases can cause diabetes, because these bacteria, they can travel in your blood system and they can cause insulin resistance leading to diabetes. Then we have Addison's disease. Addison's disease, when your adrenal gland is not producing enough hormones, you get Addison's disease. Now, when we look into this person's mouth, we will see a lot of spots, striations, and one particular smell. So this is Addison's disease. Then you have skin disorders. Now, dentists are part dermatologists, to be honest. So whenever they see, they need not look at your hands to say that you have a dermatological disorder. They can look into your mouth and say you have certain kind of skin diseases. So like lichen planus, like lupus, like psoriasis. Now, psoriasis is very common and it appears as white patches. So these kind of diseases are very easy for a dentist to diagnose. You might think it's a rash. The second you come to us, we will be like, it's not a rash. Now coming to nutritional deficiency. Now, nutritional deficiency and oral health are very much interlinked. The second you stop eating properly, you will have nutritional deficiency. So starting with the first nutritional deficiency, it's vitamin B complex deficiency. So there is a very big tendency in vitamin B complex deficiency that you will get ulcerations in your mouth. So whenever a person is having ulceration, they tend to prescribe themselves with, vitamin B complex, or they just wait for it to go, or they'll apply some kind of gel to numb the effect. But the whole point is, we can tell you if that ulcer is vitamin B complex ulcer or some other ulcer. You cannot overdose your body with vitamins. Just because you have an ulcer, you cannot give yourself vitamin B complex. So that is a very important thing, because self-medication is becoming very common. For example, once a person comes to me, they're like, okay, listen, I have this ulcer, do something. And I check the ulcer and I'm like, okay, it's just vitamin B deficiency, have vitamin B complex. Next time again they go, they have an ulcer, they don't come to me this time. They just take vitamin B.
On them.
Exactly. And when they do that, they don't realize what that actual ulcer was. It could have been even, HPV virus. It could have been human papilloma virus. Next step could have been cancer. They wouldn't even know. It's very important. Ulcers that stay more than 14 days in your mouth, that are dangerous. They can lead to cancer. So 14 days is the alarm sign for any ulcer. So don't self-medicate, get yourself examined. Just in case of ulcer, you can wait for a week to 2 weeks and then get it examined, because beyond that is alarm. Then you have vitamin D deficiency, basically osteoporosis, Osteoporosis is when vitamin D, you don't get enough sunlight, you don't get enough calcium, you'll have bone deficiency. Basically, your bone will be brittle, or it will be porous, or it will be bendy. So this and all can be due to vitamin D deficiency. We can see it in your mouth because inflammation, and there are a lot of signs that are very technical. If I start discussing, I have to discuss 5.5 years of my dentistry. But certain things that we see, we can tell you that this is this deficiency. And these signs are very pertaining to your oral cavity. Anytime you see something in your mouth which is not normal, anything which is super red, anything, if you're bleeding a lot, you need to go to a dentist. Then vitamin C, we have something known as scurvy, which is basically your gums become very friable, as in they can tear easily, they bleed easily, you touch, they'll bleed. So that happens in vitamin C deficiency. Then you have vitamin A and vitamin K deficiency. Again, this affects your tongue. So you will have a very shiny tongue, and your tongue, you have something known as papillas in your tongue, which helps you get the taste buds. So these taste buds are affected in these deficiencies. Now, okay, diseases, yes, we are talking. All the other diseases was not caused by something from outside, but something from outside like bacteria, virus, and fungi can also affect your body, which is very obvious. But when it affects your body, we can easily see it inside your mouth. You might never know it. It might not show physical symptoms in the entire body, but it can show these symptoms in your oral cavity or your mouth. HPV, which is human papilloma virus, human simplex virus, HIV. So actually, HIV, I have a story. When I was doing my internship, I got a patient and we were suspecting HIV. So we saw certain signs and we were pretty sure it's HIV. So obviously the patient did not know. So we asked the patient to get himself tested. And we also got ourselves tested because we, gloves and all are very important, but not protective enough. So that was there. And patient never came back with results, but there are certain things that, we can easily diagnose. Deadly diseases like HIV also can be diagnosed. Then we have measles, candidiasis. Candidiasis is very common. It's a fungal infection. If you see any white patch in your mouth, it could probably be candidiasis. Then you have deep fungal infection, tuberculosis. I think recently, like a couple of days back, we had World TB Day. So tuberculosis, it's a taboo topic in India because people don't prefer talking about it. But tuberculosis is one disease that is there in our body all the time. It's our immunity that is protecting us. So once it starts showing symptoms, it will start with the mouth, and then it will spread to other places. Visible symptoms, obviously it starts with the lungs, but visible symptoms will start always in the mouth. Then we have scarlet fever. So if I start talking about all the diseases that we can go on and on, I have to bring all my big books to talk about it. But this is a big overview. These are some very common diseases that it can be, that can be easily missed, but we can diagnose these easily. So just going to a dentist can give you a general health checkup also. So this is a very interesting picture for dentists, but it might be complex for the other people. So basically what this picture means is all these, if you have dental diseases, you can have pneumonia. So why pneumonia? These bacteria that are there in your mouth, they are capable of causing pneumonia. If it enters your lungs, because you have some disease and your immunity is not working well, they can enter your lungs and cause pneumonia. Rheumatoid arthritis, basically inflammation of your joints, pain while moving this hand, or pain while moving your shoulder, pain while moving your legs. All these are arthritis. So rheumatoid arthritis is caused by, one of the causes of rheumatoid arthritis is dental disease bacteria. Then Alzheimer's. So Alzheimer's is basically when, as you grow old, you start forgetting things. So this is what Alzheimer's is. Your brain starts changing and you start forgetting a lot of things. It's very close to dementia. So If you have dental disease and if it's getting worse, your Alzheimer's will also get worse. Yes, dental diseases can cause cancer. If you have a sharp tooth, continuously that sharp tooth is hitting your mouth, any place, let's say tongue, you're continuously biting your tongue. That area first, it will get injured. And if it happens for years, that area can develop cancer. That's because that's how our body works. It starts as defense mechanism. It starts generating cells, but overpopulation of cells happen and cancer happens. Then adverse pregnancy outcomes, like I spoke about tetracycline and all those things. Diabetes, liver diseases, gut dysbiosis, metabolic syndromes also, all these we've discussed. Now my favorite one is cardiac diseases. Yes, dental diseases can cause you heart attack. Now, this is not my favorite just like that. It's because I actually tell my patients this story and because I want them to go for the treatment. And this is true. This is 100% true. Incidences might be less, but this is 100% true. This happens. So let's consider this as a story. It's teeth to heart story. So your teeth can affect your heart. So here's how. So let's say you have, this is your tooth. Initially, you see black lines on it. So this is development of cavity or caries. So initially you see these caries developing. A lot of people have it. You need to get it checked whether it's stain or caries. You leave it for a couple of months because it's not paining. This kind of caries will never give you pain, but it will slowly go in. Once it starts going in, at one point, it will give you pain. That's because it has almost taken away major part of the tooth and has entered the nerve area. So if you see, this is enamel. So this is where the caries is in this stage. In this stage, the carie has come here and is almost near your nerves. In the next stage, it will enter this nerve area. Once these bacteria go, they will enter this and go through like this, and these are blood vessels, basically blood. Once it enters the bloodstream, then it becomes dangerous. So they go from the bloodstream and they directly go to your heart. So the whole point of telling this is because these bacteria, they love heart tissue. They have affinity towards heart tissue. They love it. They tend to go to your heart. And the second streptococcus is the bacteria's name. The second it reaches your heart, you will have heart attack. You will have cardiac arrest, endocarditis. You will start with fever, you will develop endocarditis. So heart attack is common when you have dental caries. So you need to get your dental caries checked. If something that is saving you from these heart attacks is basically purely your immunity, but you cannot always ban. Let's say you got fever. Your immunity is fighting that fever. It cannot fight these bacteria that are going in there. So it is very important to get it treated then and there. So yes, I use this story a lot with my patients because this actually gets them to go for the treatment, and treatments are very important. We know what can happen. We know the worst case scenarios. We are just trying to save you from the worst case scenarios. So what you can do to make sure you are at best health? Simple answer to it. Do not let the cavities grow. Maintain a good oral hygiene for a healthy body. And not just that, healthy lifestyle is also very important. And doing physical activities, good diet, all these play a key role, not just in oral health, in your entire systemic health. So next couple of slides are basically certain questions that I often got asked by my patients. So I thought I'll put it here so that these are very common queries that, would help people. So first one is, how many times should you brush your teeth? So everyone knows the answer, but I don't know how many of them actually do it. You should brush your teeth twice. Once before eating and next after finishing your last meal of the day. So you should brush your teeth twice. Half of the patients who have come to me, whenever I would ask how many times you should brush, they're like, yeah, we should brush twice. How many times do you brush? They're like, yeah, once. So that is very common. We know the right thing, but we won't do it. So next one is manual toothbrush versus electric toothbrush. Now, I get this asked a lot, like which one should we go for? Should we go for manual toothbrush or electric toothbrush? So obviously electric toothbrush is better because efficiency is better. You cannot keep going like this, like this, like this in your mouth properly. You might miss this area, you might miss that area. So electric toothbrush, it gives you the right pressure and it goes every angle in every angle. So it reaches every point where you generally tend to miss with manual toothbrush. Obviously, manual toothbrush is also good. It is equally effective. Electric toothbrush, it is a little more efficient. So that is the only difference. So you go for this or that, it is fine. But electric toothbrush comparatively is a slightly better. And some of them even ask me that, electric toothbrush, we have sensitivity after doing this. It's, damaging our tooth. No. These electric toothbrush, before getting manufactured, they're all checked. They are supposed to give only one particular pressure. They cannot go beyond that threshold. So these will give you proper pressure only. Next is, how many times should I change my toothbrush? A lot of them don't even change their toothbrush until, all the fragments are out and they're like, okay, now it's not even brushing. So you should actually change your toothbrush like 3 months once, because the bacteria start growing in it. So it's very important to change your toothbrush every 3 months. How much toothpaste should I use? So what we tend to do, we just take and we apply throughout the brush like a stroke, and then we brush. That much is not required. So a pea size is enough for an adult. So this, as you can see, the size of a pea, that much of toothpaste is enough for an adult. Let's say you have a kid who's lesser than 3 years old. That time, enough of a rice grain size. So less than 3, rice grain size. More than 3 to any age is pea size. Also, one more question is, what kind of toothpaste should I use? Avoid using gel toothpaste. Always use paste, the white paste. Take it in your hand, touch it like this. If it is soft, it is perfect. Avoid toothpaste with crystals, with salt, with charcoal, because not now, but later it will slowly cause sensitivity. Because when you take something hard or something rough and start rubbing it over your teeth, it will slowly remove a layer of your teeth over a period of time. And if, let's say you start doing this at 20, at the age of 40, you have sensitivity in your teeth. Why? Because one layer of tooth is already out. Because our tooth are strong, but slowly one layer will get taken off. It's like how water hits on rock every day and it becomes, slowly it becomes smaller. Same thing happens to our teeth also. So white paste, normal white paste that you can take in your hand and just rub. So brands doesn't matter, but avoid anything with any additive in it, like salt, crystals, and all these things. Avoid gel paste. Gel paste are not efficient enough for your teeth and they lead to more problem. Then how should I brush my teeth? So this is something very important because I see people who just go left, right with their teeth. So it's very simple actually. You have to take your toothbrush, like even I have a model here. So you can take your toothbrush and place it 45-degree angle in between your gum and teeth. So in between your gum and teeth, and then you go round motion. You keep going round motion entire outside. When you open inside, so for inside, you just have to go sweep motion. You don't have to do anything, just sweep motion. So this is how you should brush your teeth. You should never brush like this. If you brush like this over a period of time, same what happens with toothpaste, it will take off one layer and it will cause sensitivity in your teeth. Then how should I use a mouthwash? Before that, should we use a mouthwash? The answer to that is yes, you should use a mouthwash. Using a mouthwash is pretty simple. You take half of the mouthwash and half of water. Generally, I tell my patients 5 ml of water, 5 ml of mouthwash, mix it, and then take it in your mouth, and then swish it around. Swish it around in all aspects of your mouth, that it's reaching every little end of it. And then after 30 seconds, you can spit it out. So this is how you're supposed to use mouthwash. Now, what kind of mouthwash you should be using? Alcohol-free mouthwash. Alcohol will cause dryness in your mouth, so it's very important to use alcohol-free mouthwash. And when to use a mouthwash? So there are three things to it. A, you can use mouthwash before brushing. So I always tell my patients to use mouthwash before brushing, because when you use it before brushing, all the dirt and deposits, they get very loosened. Once they're loose, you can easily brush all the deposits out. So if it's hardly stuck, if it gets loosened afterwards, when you brush, it will easily come out. So this is the concept of using mouthwash before brushing. Now, if you use it after brushing, then it basically gives you only mouth freshness, nothing else. It will not give you anything else but only mouth freshness. So you should know your purpose. If you want to clean your teeth better, use it before. If you want only freshness in your mouth, then use it after. You can also use it before and after, but that much is not required. And you should use mouthwash only twice a day, maybe once in morning and once at night. Then should I use a floss? Well, if you want to save your teeth, then use a floss. If you want your teeth to be intact till old age, then use floss. So you have three types of floss. One is the thread floss. Another one is the toothpick floss. And third one is the water pick floss. Out of all these three, water pick is the most efficient. So basically it is a jet spray of water that will floss your teeth. How to floss? You take your two fingers, wrap the floss 2.5 turns in one finger, 2.5 turns in the other finger. Take it in between your two teeth, and saw motion, you have to go up and down, up and down. So in a saw motion, you're going up and down, up and down. So these areas are important to clean because your toothbrush cannot clean these areas. If you don't like using floss, then you can go for water pick. So this is a water pick is water floss basically. It is a jet spray of water that you should run along the gums and where your gum and teeth meet, run it along, and it would give efficiently clean all the dirt and deposits, whether on the sides or in the middle. So it can clean it every single place. So initially, a lot of people will experience bleeding and they will find it a little harsh for the teeth, but that's because you're taking off deposits and you might bleed. That is the whole point. But after, a week, your body will get used to it. The gums will go back in their original position, how they're supposed to be, and you will stop bleeding. Last question is, how often should you see a dentist? Well, you should see a dentist every 6 months once. You should get your scaling done every 6 months to 1 year. Scaling, there are a lot of myths attached to scaling, that when you scale your teeth, your tooth will loosen or your tooth will, they are weak, but that is not true. You just take off the deposit between your gum and tooth. So now there's nothing holding it. That is why it seems to be weak. But within a week, the gum attaches itself back to the tooth and your tooth are back in grip. They are no more in movement. So every 6 months, you should see your dentist and make it a habit. Regular checkups are very, very important. Not just because, you should get your teeth checked, but they're actually checking your entire body. So it is very normal for a dentist to examine the entire mouth for 7 months. In fact, we don't just see the mouth, we see the entire face. We are head and neck specialists. We see from head to neck everything. Our procedures also are pertaining to head and neck. So everything, even, cosmetic procedures, dentists do. So this is how I'm going to conclude. Dentists can check the entire body. You need to give them a chance. And your mouth is basically a window. It's window for your entire body. You just need to find the right person to see what's inside. But that doesn't mean that you just go to a dentist and be like, okay, I don't have anything. You should also get your general health checkup done every now and then. It's important to get your master health checkup done every year. It's important to meet a physician every now and then. Monitor your sugar, BP. Know if your parents have it or you have family history of cancer, BP, sugar. You should often check it. For women, it's very common to get breast cancer. You should know how to examine it. You can go to your gynecologist. They can teach you how to know if you have breast cancer or not. Like you can check it yourself. So these things are very important. So on this health day, we should know what kind of things we should be following. Age screening is very important. Age screening means basically that at particular ages, you're supposed to get yourself screened for particular diseases. So you can easily find it on net what kind of diseases you should get screened at what time, and you should follow that. This will give you more longevity and you will have a better health. And this is not it. You have to maintain hygiene. You have to maintain oral and whole systemic hygiene. You have to maintain a good lifestyle. You need to be fit, have good amount of physical activity. You should get into fitness, and you should have a very good diet, a very clean and a very good diet. So with this, I finish my session, and
Thank you so much, Krishanga. Before going ahead, there are a few questions I can see on chat. Then I have a long list, so I'll ask about that little later.
okay.
So first one was the toothpaste, which is the good toothpaste you have already answered. There is one question: what are best and worst food for our teeth?
What are best food for our teeth?
Hmm.
Okay, so
Best and worst.
okay, any fibrous food is very good because it will help self cleanse your teeth. Let's take apple. When you eat apple, you feel it going inside the crevices of your teeth. And when you do that, it's actually cleaning in a way. And these are all good sugars. Fruits, they have fructose. Fructose is good sugar. It is good for your body. So any kind of fruit, vegetable is good. What is harmful for the body is any kind of carb or sugar. So when you obviously moderate amount of carbs are important for your body for energy. But when we talk about sugar, sugar is also, carb is a form of sugar, and sugar has sucrose. These sucrose and sugar particles, they go and stick. They have an affinity to stick to your teeth. When they stick and they're not cleaned properly, they tend to cause cavity. So simple, if you want to eat dessert, eat in moderation, obviously, don't eat a lot. But if you are eating, make sure you take hot water after that, or you gargle your mouth once at least. So this will help you stay protected, and you don't even have to miss on something. But obviously, you cannot take a lot of sugary items. You have to keep it in control. A lot of carbs is also not good. You have to keep it in moderation. Fruits and vegetables are very good.
Okay, thank you so much. Firstly, what you said is so true that we really ignore the dental part or the oral health. And like throughout the session, I can say, other than you should brush your teeth twice, that again, you said that we do it once. I don't think that people are really aware that there are so much that we have to know about it, and we have to like follow certain things. So firstly, of course, like when I was going through the session, I realized, oh my god, this is so important, oh my god, this is so important, we never knew this, we never knew that. So yeah, people know that we really tend to avoid the dental or the oral part, but there is so much to know about it. I mean, I'm sure gonna share this link to like all the people I know, because people are really ignoring so many things. As far as the heart and the dental health is concerned, I recently got to know about it, that there is a connection. So that is why I said that I'll talk about it later. Firstly, we'll answer others. So there is a kid in my like, he's my friend's kid, and he's having a heart problem since birth. So yeah, he went for the first surgery when he was 7, and now the final surgery was done. But the doctor mentioned that you need to take care of the dental. So it is just that what people do कि अच्छा डॉक्टर ने बोला है कि दांतों का ध्यान रखना है. जो reason है, the cause है, the connection, like they told me that for him we really need to be very careful for the dental thing. And I really want to mention it here because you mentioned it, but I have a case that it is mentioned from the cardio people, that बाकी जो चीजें हैं जो आपको मेडिसिन फॉलो करनी है, जो ब्लड थिनर दिया जाता है, they have actually clearly mentioned and highlighted in fact that you have to take care of the dental problem and the oral health. अब उन्हें ये बोला गया था कि it's the plaque that settles down. I am gonna share this link to them. The parents need to know the blood wala thing that you mentioned. So, this is one problem with us, that when the doctor says you have to do it, we follow that. Why we don't ask question, how is it related? Like, I am a very curious person, like मुझे लगता था क्या होता है. I asked them कि how is, मुझे लगता था कि वो vein connected है क्या, कि pressure होता होगा तो heart पे or something. And then it's about a kid, so you get more conscious, and how will you stop them from sweet craving and all. So that was another challenge and all. But आपको जब पता हो the seriousness, because this I have never heard from them. So they need to know. I am gonna share this to them. कि the blood vessel wala, they are not aware. They when I asked them what is the relation, they said that वो जो plaque है ना, they said कि वो भी settle हो जाता है, और वो जो the blockage will be there and all. But this is something which can be like, for a normal person who's not having a heart issue, they also can get this thing if they avoid the oral health. So somebody who's having the thing, उनको तो जानना ही चाहिए. And in the same family, जो second मेरा concern था वो ये था, like you said that the cracks, or there is something which is like, which lasts for more for 14 days, you said, right?
Yeah,
If
ulcers, any ulcer that lasts for more than 14 days, any
if
ulcer
somebody
is.
is having something in the mouth, say a extra part or something, but it is not hurting, like the same kid's mother, she is having something in her mouth, like it's extra part in the cheek or something, it is not hurting, and it is since years. So it is not hurting. She even went to show it to somebody, and they said कि operation करना पड़ेगा. And again we have this tendency कि अरे काट कूट हो तो हम avoid करते हैं. So I wanted to know कि if there is extra, and it is not by birth. वरना हम ये मान लेते हैं ना कि कभी कभी you get something by birth and it is not harmful. So I wanted to know that कि अगर कुछ ऐसा development है in your mouth, but there is no problem other than that. She used to get ulcers and all earlier बहुत ज्यादा, अभी ऐसा कुछ नहीं. But that जो एक extra development है, it is very much there, but it is not hurting her. But do you think it is because if I know them from what, some 3.5 years, she told me बहुत सालों से है, मतलब she is not even aware कि कब से है. So do you think that she needs to get it checked, or there is something serious or something like that?
Obviously, she needs to get it checked. Since I cannot look at it, you need to see how it looks. Only then you can give a proper diagnosis. But it's nothing to worry about since it has been there for years. It could be any kind of growth. But the second it starts coming in your teeth, it becomes a problem. The second it starts getting infected often, it becomes a problem. The second you start eating hard stuff, it hits there, it becomes a
Right.
problem. She might not even realize it, or she does, but she ignores it कि उस पे लग रहा है again and again. If she eats anything hard, कोई snacks, let's say she's eating and it's hurting there, but she is ignoring, because we tend to do that, right? If there's an injury, we leave it. So then it becomes a problem. Obviously, she has to get it examined. And surgery, what they're talking about, if anybody has suggested surgery also, it's not a big procedure. It's just giving local anesthesia, one injection that side, and excising it. Just removing that area. So it's literally 5 minutes procedure. But it is whatever it is benign. It is not spreading. Otherwise, it would have spread by now if it has been there for years. So it's not something to worry about, but you have to be cautious. If it is not giving a problem, it can be left. But if it's showing some other discoloration, if it is growing in size, or if it is, showing difference in texture, then it's a problem. If it is changing colors, is very important. If it's becoming red or if it's becoming normal, everything that needs to be checked. And if it's hard or soft, all of those things needs to be examined.
Okay, thank you so much. Anyone else
मेरा
is
एक
having?
क्वेश्चन था,
हाँ जी प्रीतम जी.
दंत मंजन अच्छा होता है कि टूथपेस्ट अच्छा होता है?
दोनों ही अच्छे होते हैं. टूथपेस्ट थोड़ा कन्वीनियंट होता है क्योंकि वो आसानी से आप लगा सकते हो, लेकिन आप दंत मंजन यूज करोगे वो पाउडर फॉर्म में, तो वो इतना इफेक्टिव नहीं होता है. मतलब पाउडर इतना सब जगह जाके जाता नहीं. तो उस हिसाब से टूथपेस्ट बेटर है, लेकिन दोनों ही अच्छे हैं. दोनों से कोई स्टडी नहीं है.
दंत मंजन से मसाज हो जाती है कि उसकी?
हाँ, वो तो एक्चुअली हम लोगों को अपनी उंगलियों से मसाज करनी ही होती है. हम लोगों को ऐसे ऐसे दांत को मसाज करना होता है.
अंदर गम्स की अंदर से मसाज हो जाती है.
हाँ, एक तरह से हो जाती है, बट वो आप कुछ भी करेंगे उससे होगी. तो अगर आप वो नीम की जो स्टिक होती है उससे अगर आप कर रहे हैं तो वो सबसे अच्छा होता है। वो स्टडीज हैं कि मुस्लिम पॉपुलेशन में वो बहुत होता है, उनके यहाँ वो लोग नमाज पढ़ने के बाद उसी से करते हैं। तो जब वो यूज करते हैं उनकी जो केरीज या जो दांत खराब होने का जो लेवल है वो बहुत कम है। तो मंजन से ज्यादा वो डंडी अगर आप यूज करें वो बेटर है। जो डेंटल पाउडर है, जो मंजन है या पेस्ट है, ऐसी कोई भी स्टडी अब तक है नहीं जो बोले कि ये बेटर है वो बेटर है। दोनों में इक्वल ही बताया जाता है।
थैंक यू।
Anyone else is having any question or want to share their view about the session also? Because as far as like my thing is concerned, the questions were on one thing, but the session was really informative.
Yes.
I think I see one question which is should we drink cold water or normal water? Whatever you want you can drink, to be very honest. लेकिन मीठा खाने के बाद गर्म पानी पीना बहुत इंपॉर्टेंट है, उससे वो बैक्टीरिया थोड़े से मर जाते हैं, तो दैट इज इम्पोर्टेंट। इफ यू आर हैविंग सेंसिटिविटी, मतलब अगर आपको कोई भी वहां पर सेंसिटिविटी हो रही है तो ठंडा पानी अवॉइड करिए। और ये जो पेस्ट होते हैं सेंसिटिव वाले टूथपेस्ट, जैसे सेंसोडाइन हो गया या कोई भी सेंसिटिव पेस्ट हो गया, यू शुड नॉट यूज इट कंटिन्यूअसली। अगर आप रोज उसे यूज कर रहे हैं आपकी बॉडी उससे यूज टू हो जाएगी। और अगर आपकी बॉडी यूज टू हो गई, जब भी आप ये टूथपेस्ट नहीं मिलेगा आपको, तो आपके बहुत ज्यादा झुंझुनाहट होगी, बहुत ज्यादा सेंसिटिविटी होगी। तो इसीलिए क्या करना होता है, जब भी आपका कोई दांत सेंसिटिव है उस पे हल्का सा पेस्ट लेके बस लगाना होता है और छोड़ देना होता है 2-3 मिनट के लिए, और फिर वॉश कर दीजिए। बट जब हो सिर्फ तभी, जब सेंसिटिविटी ना हो तो नॉर्मल पेस्ट। अगर रोज सेंसिटिविटी हो रही है, सारे दांतों में सेंसिटिविटी हो रही है, मतलब आपके दांत का कोई हिस्सा, मतलब धीरे धीरे ब्रश करके होता है, एज के साथ होता है कि वो निकल जाता है, इसीलिए हो रही है, तो उसके लिए आपको कोई प्रोटेक्शन लगवाना पड़ेगा। मतलब आप अगर डेंटिस्ट के पास जाएंगे वो उसके ऊपर एक कवर लगा देंगे, जैसे फिलिंग होती है सामने की तरफ भी फिलिंग होती है, उससे वो सेंसिटिविटी नहीं होगी।
ये ट्रांसप्लांटेशन की लाइफ कितनी है?
किसकी?
टीथ ट्रांसप्लांट करते हैं ना।
अच्छा, तो टीथ अगर तो 2 टाइप के ट्रांसप्लांट होते हैं। एक में आपका खुद का दांत लगता है, लेकिन वो सिर्फ एक्सीडेंट केसेस में लगता है। अगर आपका एक्सीडेंट हुआ है और विद इन 1 आवर आप अपने दांत को अपने ही सलाइवा में रख के या मिल्क में रख के लेके आए हैं, तो वो हम लोग वापस लगा सकते हैं। लेकिन इट्स वेरी इंपॉर्टेंट कि अगर एक्सीडेंट हो रहा है, दांत निकला है, तो उसे मिल्क या सलाइवा में ही रखे, हाथ में कभी लेके नहीं आना। तो बेस्ट होता है अपने ही माउथ में सलाइवा में उसे रख के ले आए। तो वो उसकी वो डिपेंड करता है कि वो सक्सेस रहेगा या नहीं रहेगा। ये बहुत कम केसेस में होता है, सिर्फ एक्सीडेंट केसेस में ये देखा जाता है। दूसरा होता है इम्प्लांट। तो इम्प्लांट में एक स्क्रू लगाते हैं आपके दांत में, आपके बोन में, वो बोन से सपोर्ट होता है एक टूथ। आई थिंक मेरे पास ये है, तो इसमें अगर आप देखेंगे ये इम्प्लांट है। तो ये इसका सक्सेस आपकी डायबिटीज पे डिपेंड होगा। अगर आपका शुगर लेवल हाई है, अगर आपका HbA1c लेवल हाई है, तो आपका फेल डेफिनेटली हो जाएगा। अगर आपका ओरल हाइजीन अच्छा नहीं है तो डेफिनेटली फेल होगा। अगर आपकी बोन बहुत पतली है तो फेल होएगा। उसके अलावा इसके सक्सेस रेट बहुत अच्छे हैं, और ये लॉन्गेविटी वाइज इनका 10 साल तक बोल सकते हैं कि हाँ 10 साल तक ये आराम से चल जाएगा। उसके आगे आपने अगर अच्छे से उसको मेंटेन किया तो चलेगा, अगर अच्छे से मेंटेन नहीं हुआ या कोई भी प्रॉब्लम हुई, जैसे डायबिटीज आ गई या आपका शुगर हाई हो रहा है बहुत, तो वो फेल हो जाएगा। अगर आप 2 साल में भी फेल हो सकता है, वो सब आपकी बॉडी पे डिपेंड करेगा। बट ये अच्छा सोल्यूशन है। अगर सिर्फ एक दांत लगाना है या कुछ दांत लगानी है, फिक्स्ड रहता है, इसको निकालना नहीं पड़ता। तो रिमूवल में आपको जब निकालना पड़ता है, या तो आप अपनी खुद के दांत पे लगा रहे हो, या अगर कुछ नहीं है तो ऐसे ही लगा के निकाल रहे हो, वो थोड़ा डिफिकल्ट हो जाता है। तो इम्प्लांट उस हिसाब से बेटर है, बट अगेन उसका सक्सेस उसी पे डिपेंड करेगा जैसे आप अपना ओरल हाइजीन मेंटेन कर रहे हो और अपना ब्लड शुगर कंट्रोल में रख रहे हो।
थैंक यू, इट वाज वेरी नाइस एंड इंफॉर्मेटिव सेशन। आई एम हाईली ऑब्लाइज्ड। और ओल्ड एज में किस तरह से ज्यादा दांतों का ध्यान रखा जाए ये भी बता दीजिए।
हाँ, ओल्ड एज में एक तो पहले सबसे इम्पोर्टेंट चीज है, दांत गिरना नॉर्मल नहीं है। आप जितने भी ओल्ड हो, दांत गिरना नॉर्मल नहीं है। आपके सारे दांत अगर अच्छे से मेंटेन है तो वो इंटैक्ट रहेंगे, एक भी दांत नहीं गिरेगा। तो इट इज अबनॉर्मल अगर आपके दांत गिर रहे हैं। अब मेंटेन करने की बात आती है, सबसे बड़ी प्रॉब्लम क्या होती है, हमारी जो गम है वो थोड़ा थोड़ा नीचे जाने लगता है।
Yes, that's right.
हाँ, तो वो क्यों होता है, क्योंकि वहां पर एक डर्ट की लेयर हो जाती है। ये डर्ट की लेयर सिर्फ स्केलिंग से निकल सकती है। स्केलिंग एक डेंटिस्ट जब आपके दांत साफ करता है एक मशीन से, आप अपने हाथ से ब्रश से करेंगे नहीं निकलेगी वो लेयर, क्योंकि ये बहुत स्ट्रॉन्ग लेयर होती है और ये काफी सालों से मेंटेन बन जाती है। और जब आपके गम्स भी नीचे हो रहे हो, बहुत सारे रीजन की वजह से होते हैं। मेन रीजन उसका यही है कि वहां पे बहुत सारी डर्ट है। तो हर 6 महीने में अगर आप स्केलिंग करवाए अपने दांतों की, तो वो आपके दांतों को काफी टाइम तक रखेगा। 2 बार ब्रश करना, 2 बार माउथ वॉश यूज करना, 2 बार फ्लॉस यूज करना, ये सब चीजें करना हम लोगों के दांत को ज्यादा टाइम तक रख सकता है। तो आप अगर ये सब करेंगे तो आपके दांत ऑब्वियसली ज्यादा रुकेंगे। ज्यादा हार्ड मतलब जो फाइब्रस जिसमें ज्यादा चबाना पड़ता है वो खाना बहुत अच्छा होता है, जैसे ये फ्रूट्स और वेजिटेबल्स। तो अभी हम लोग बहुत प्रोसेस्ड फूड खाते हैं, इसलिए हमारे दांत इतने अच्छे नहीं है। लेकिन अगर आप बहुत टाइम पहले का देखेंगे, उनके दांत बहुत अच्छे थे, जो हिस्टोरियंस थे उनके दांत काफी अच्छे थे। क्यों? क्योंकि वो लोग ऐसे फ्रूट्स वेजिटेबल्स अनकुक्ड फूड ये सब बहुत खाते थे, तो उससे दांत हमारे वैसी फंक्शन में रहते थे। तो अगर आप देखेंगे कई बार कुछ लोगों की क्या होता है, एक तरफ वो लोग नहीं खाते हैं, वो इसलिए नहीं खाते क्योंकि उनके दर्द हो रहा है, तो वो लोग सिर्फ एक तरफ से खाते हैं। फिर क्या होने लगता है, यहाँ का जो जॉइंट है वहां पे दर्द होने लगता है, वो अपना पूरा मुंह नहीं खोल पाते। तो आप बेसिकली प्रॉब्लम दे रहे हो। कभी भी एक तरफ से नहीं, हमेशा 2 तरफ से चबाना होता है। अगर दर्द है तो जाके डॉक्टर को दिखा के उसे ठीक करवाइए, वरना यहाँ पे प्रॉब्लम होगी। यहाँ प्रॉब्लम हुई, कान में प्रॉब्लम हुई, कान में प्रॉब्लम हुई, फिर हेडेक शुरू हो जाएंगे। तो ये बहुत कॉमन है। अगर आपके दांत में प्रॉब्लम है और हेडेक हो रहा है तो ये बहुत कॉमन हो जाता है, क्योंकि कोई प्रॉब्लम है आपके दांत में।
ठीक है, थैंक यू, थैंक यू।
मैं तो सोच रही हूँ कितने मेरे जान पहचान के लोग हैं जिनके केसेस मुझे आ गए, ये जो दांत से यहाँ तक जाने वाला पेन है बट। एंड वो जो है उन्होंने मुझे ये भी बोला कि मुझे ये समझ में नहीं आ रहा है कि मुझे यहाँ पर प्रॉब्लम होती है चबाने में और सिर दर्द जो होता है। एंड एज यूजुअल 10 लोग बैठ के 10 ज्ञान देते हैं, ये तुम स्ट्रेस लेती हो उसकी वजह से होगा, दिस इज फॉर समथिंग एल्स। नाउ आई कैन सी दैट नो इट इज। और वो बोलती भी थी कि कोई यहाँ की नस दब रही है क्या, ये हो रहा है क्या। अच्छा, हियर आई हैव अनदर क्वेश्चन। रूट कनाल फॉर किड्स इज हाउ मच नेसेसरी, स्पेशली जिनके वो जो दूध के दांत नहीं गिरे हैं। बिकॉज अगेन लाइक इन अ फैमिली देयर आर 2 किड्स। अब वो स्कूल में जो अपना डेंटल चेकअप होता है तो उनको बोला गया है कि रूट कनाल है, यू गो एंड सी अ डॉक्टर। सो जो छोटा बच्चा है उसका रूट कनाल कर दिया डॉक्टर ने, और जो बड़ा है हु इज हैविंग द हार्ट प्रॉब्लम आल्सो, फॉर हिम दे सेड कि नहीं बच्चा है तो अवॉइड कर सकते हैं। सो आई रियली वांटेड टू नो कि क्या छोटे वाले का जबरदस्ती कर दिया, या बड़े वाले का अगर अवॉइड किया जा रहा है तो नहीं, अगर रूट कनाल है देन ही शुड गो एंड सी द डॉक्टर।
तो रूट कैनाल भी छोटा या बड़ा इम्पोर्टेंट है। अगर आपका मिल्क टीथ भी है, मिल्क टूथ है या दूध का दांत है, वो दांत ना बहुत ही पतला होता है। तो वो बैक्टीरिया ना आराम से उससे खा के निकल के जो नीचे परमानेंट दांत आने वाला है उस पे जाके अटैक करता है। तो जब दांत आता है तो उसमें ऑलरेडी वहां पे कैविटी होती है। इसीलिए मिल्क टूथ का रूट कैनाल करना इम्पोर्टेंट है, क्योंकि वो ज्यादा जल्दी स्प्रेड होता है। बट इसका ये मतलब नहीं कि एडल्ट वाले का नहीं करा, प्रोबेबली उसको हार्ट डिसीज है, इसीलिए उसका सब कुछ जितना वेट कर रहे हैं उतना वेट कर रहे होंगे। क्योंकि हार्ट डिजीज और हाई शुगर, हाई ब्लड प्रेशर, इस सब चीजों में पहले मेडिकल चेकअप लेना पड़ता है, मेडिकल फिजिशियन से एक अप्रूवल लेना पड़ता है, फिर ही आप ये सब कर सकते हो। अगर बहुत हाई डायबिटीज है तो आपको एडमिट करवा के इंसुलिन एक दिन रख के फिर उसके बाद करेंगे। बहुत सारे डिसऑर्डर्स है, जैसे ब्लड थिनर्स पे हो या कुछ भी, एक पर्टिकुलर फूड वो बंद करना पड़ता है, विच इज रिस्की। तो पूरा समय उसे हॉस्पिटल में मॉनिटर करना पड़ेगा, फिर ही उसके बाद। अगर बच्चा इतना स्ट्रेस नहीं लेगा तो वो लोग नहीं करेंगे। बट अगर उन्हें लगता है कि हाँ ये कुछ दिन और चल जाएगा तो वो लोग उसे रख देंगे वैसे। लेकिन
बट ऐसा नहीं है ना कि दूध का दांत है तो वो तो चला जाएगा, फ्रेश दांत आना है तो रूट कनाल की जरूरत नहीं है।
नहीं
और अदर किड्स हु आर लाइक उनको जिनको कोई तो ऐसा नहीं है ना कि हाँ, मतलब बिकॉज दिस इज सम मिसकंसेप्शन जो मुझे लगता है लोग ना आपस में ही बात करके एक सोल्यूशन निकाल लेते हैं।
वो बोलते कि निकल जाएगा।
हाँ मतलब, और मैं ऑनेस्टली मैं भी बता रही हूँ, मुझे भी ये थॉट आया कि हाँ इन्होंने ना वो बच्चे के लिए उल्लू बना दिया कि हाँ यार उसके तो दांत अभी गिरने वाले होंगे तो उसका रूट कनाल क्यों किया, जबकि वी ऑल नो रूट कनाल इज द रूट, नॉट द दांत का थिंग ना. If it is actually getting inside, then they say अगर वो सिर्फ डेंटल लेवल पे रहेगा वो क्लीन कर देंगे, वो कैविटी रहेगा वो फिल इन कर देंगे. If they are talking about root canal, that means they are talking about the root. अब again what people think is it will damage your gums. This thing that you mentioned कि वो जाएगा और जो नया वाला दांत है वो उसको भी spoil कर सकता है, इतना दिमाग किसी ने नहीं दिया होगा. That this is really a big problem in people, हाँ, that आपको नहीं पता. You will not say that I don't know, you should check with someone else. वो बोलेंगे शायद ऐसा होगा, अब वो शायद अगले तक जाकर हट जाता है, and it becomes an info. इन्होंने मुझे बताया था, so I know. अरे पिछले वाले ने शायद वर्ड यूज किया है, इंस्टेड की 5 लोगों में से कोई एक, like for example if I have attended this session and I can like share it to others, तो जो 4-5 लोग होंगे जिनको वो कंफ्यूजन होगा उनके बीच में क्लियर हो जाएगा. हम सबसे ज्यादा क्या करते हैं, मिसकंसेप्शन और मिथ्स को स्प्रेड करते हैं. अभी अगर it is all luck, I'll say na, that ma'am asked me and I attended the session and I so many things. I am telling you 3-4 किस्से तो मैं मुझे ही पता चल गए कि लोगों के साथ हो रहे हैं. रूट कनाल भी मैंने भी सोचा कि हाँ यार ये ना डॉक्टर ने उल्लू बना दिया कि बच्चे के तो दूध के दांत गिर जाते हैं, एंड दे आर सेइंग ओ माय गॉड दे चार्ज सो मच, हम लोग को पहले इस वाले डॉक्टर के पास जाना चाहिए था. दे आर नॉट अंडरस्टैंडिंग दैट दिस इज 2 डिफरेंट केसेस फर्स्टली, एंड देयर इज अ पॉसिबिलिटी कि उस बच्चे का शायद ज्यादा डीप होगा और इसमें सुपरफिशियल होगा. ओके, थैंक यू सो मच, माय गॉड.
नहीं बट बहुत इंपॉर्टेंट है. मैंने भी बहुत लोगों को आके कहा, वो लोग मुझसे ये कहते हैं जब भी कोई बच्चा आता है वो कहता है ये तो गिर ही जाएगा, तो मेरे को बैठ के उन्हें एक्सरे दिखाना पड़ता है. अच्छा देखिए यहाँ से वो निकलेगा और इस दांत को इफेक्ट करेगा. अगर डेंटिस्ट को लगता है कि रूट कैनाल तभी सस्टेन करेगा जब रूट्स हो, अगर रूट अब्सॉर्ब हो गई मतलब दांत गिरने वाला है, हम सीधे उस दांत को निकाल लेंगे, कोई प्रॉब्लम नहीं होगी हमें, हम वो ही करें. लेकिन नया जो आने वाला है वो रिप्लेस नहीं हो पाएगा, तो हम रिस्क लेंगे उसकी. सिर्फ मिल्क दांत के साथ, हाँ, क्योंकि मिल्क दांत अगर एक ह्यूमन नॉर्मल एडल्ट के दांत में कोई इन्फेक्शन ट्रांसफर होने में 1 महीना लग रहा है, वही 1 हफ्ते में एक मिल्क दांत में ट्रांसफर हो जाएगा, क्योंकि वो इतना पोरस होता है, तो बहुत फ्रेजाइल होता है. तो इसीलिए
मैम गुड मॉर्निंग. मेरा एक बेसिक क्वेश्चन है. ये जो हम ब्रश करते हैं सुबह या जो भी टाइम में ब्रश करते हैं, तो ये कितने ड्यूरेशन के लिए एक ब्रश होना चाहिए? मतलब 5 मिनट, 5-6 मिनट, 3 मिनट, मतलब एक सॉर्ट ऑफ कितने देर मतलब करते रहना चाहिए इसको?
तो 2 मिनट आइडियली, वैसे 30 सेकेंड्स ऐसे, 30 सेकेंड्स यहाँ, 30 सेकेंड्स यहाँ, 30 सेकेंड्स यहाँ, आप ऐसे यहाँ पर पूरा करें. तो 4 हिस्से हैं, तो अगर ये दांत है तो इसको आप 4 में डिवाइड करिए. एक तरफ 30 सेकेंड, एक तरफ 30 सेकेंड, एक तरफ 30 सेकेंड, एक तरफ 30 सेकेंड. उससे ज्यादा इंपॉर्टेंट ये है कि आप यहाँ पे सही सही उसे गोल घुमा रहे हैं. आप जितने भी मिनट कर ले, अगर आप सही से गोल नहीं घुमाएंगे तो वो नहीं होगा. ऐसे ऐसे करेंगे तो आपको बाद में सेंसिटिविटी ही होगी. तो 2 मिनट आइडियल है. उससे ज्यादा अगर आप 5-10 मिनट कर रहे हैं, उससे वो ज्यादा साफ नहीं होगा, उससे बल्कि आप अपने दांत का लेयर निकाल रहे हैं. तो उस दिन नहीं पता चलेगा, 10 साल बाद पता चलेगा, अरे मैं इतना ब्रश करता था इसीलिए वो और सेंसिटिव होता गया. तो 2 मिनट आइडियल है. उससे फर्क नहीं पड़ता, सिर्फ 2 मिनट काफी है. अच्छे से एफिशिएंटली करना चाहिए. 30 सेकेंड्स 30 सेकेंड्स 30 सेकेंड्स.
वो people have this tendency ना कि कुछ
how do you use your brush? I want to know. It should be up and down, I was told by the dentist.
So it's not very simple. Yeah, so there are multiple methods. So there are 3 methods basically. When you do up and down, you don't tend to reach all the areas. So every dentist has adopted their own method. Out of the 3 prescribed methods, every dentist will prescribe only the method they find the best. I find in my patients this to be the best. So what I suggest is go 45 degree between your gum and tooth. When you go 45 degree, you end up reaching your gum also. It's important to clean your gum. When you do that, when you go in circular motion, you're giving equal pressure. Especially with manual toothbrush, it's important to give equal pressure. The second you give uneven pressure, it is gonna cause more harm. So circular motion distributes the pressure evenly. That is why I prescribe my patients always to go in circular motion. When you do up and down, you will not get a proper, cleanliness basically. It won't clean it more efficiently. So that is why I don't say this method. Though sweeping method is, said to be very useful in when you're going lingual side, as in when you're going in the inner side of the teeth, which is towards the tongue and towards the palate. When you clean these upper areas, this area, from where you chew, the molars, you have to go straight up and down, because there's no other way to clean this. So that is why I tell my patients the Phones method. Phones method is the circular motion. Yes, you have up and down, whatever it is. This method should never be done. Whatever it is. This method, there is no data for this method. It only causes harm.
Should one use a battery brush? And also, I wanted to know that mouthwash normally we hardly use. Is it important to use it?
So first I'll answer the first part. Electric toothbrush, battery brushes are better. They clean more efficiently. Pressure is distributed. That doesn't mean manual toothbrushes are bad. They're equally good. But electric toothbrush will give you more efficient cleaning. That's the whole point of electric toothbrush. So and all these, whatever I'm telling, it's all through scientific data. I only talk about things that are there in researches. If I don't know, I will not answer that. And coming to mouthwashes, yes, it's very important. Not for the freshness part, but for proper cleaning, efficient cleaning. So whenever I talk to my patients, I'll tell them, please use mouthwash before brushing, because you have a lot of deposits. You need to clean it properly. You're not able to clean it. So what it does is mouthwash will go and attach itself to the deposits called plaque. When it does it, it will become loose. So plaque will be held like this. When you give mouthwash, it will become like this. So when you put your brush, it will easily come off. You can easily sweep it off. So that is why mouthwash is very important. Yes, mouthwash after brushing is only for freshness. That is subjective point of view. If you want freshness, if you want your breath to smell well, you can use mouthwash. Are important. If you have
it's better to do before. And it's
diluted.
How much dilution?
Yes. So 50-50. 5 ml of mouthwash, 5 ml of water. Always dilution. Otherwise, it will sting your mouth. So 5 ml, 5 ml. And use alcohol-free mouthwash. If you use alcohol mouthwash, it will cause more dryness in your mouth. So alcohol-free mouthwashes are important. And if you're getting a medicated mouthwash like chlorhexidine is very, it should be only given by a dentist and should only be used for 14 days. If you use chlorhexidine mouthwash for more than 14 days, it will cause discoloration. A lot of dentists miss this point. So if you are ever being prescribed a chlorhexidine mouthwash, then you should use only for 14 days. More than 14 days, it will stain your teeth and that stain will not go. You have to go for whitening then.
Any brand of
लौंग का तेल लगा सकते हैं क्या? लौंग का तेल?
लौंग का तेल अगर आपको दर्द हो रहा है तो वो सिर्फ टेम्पररी सॉल्यूशन।
लौंग का तेल,
हाँ, लौंग का तेल रोज ब्रश करने के लिए नहीं काम करेगा। अगर दर्द है तो जनरली लोग दर्द में लौंग का तेल लगाते हैं या लौंग लगाते हैं, वो नहीं लगाना चाहिए क्योंकि एक तो वो टेम्पररी सोल्यूशन दे रहा है, आपका एक्चुअल प्रॉब्लम वो नहीं सॉल्व कर रहा है। दूसरा, अगर आप लौंग अपने मुंह में काफी देर तक रखेंगे ना, वहां पे बर्न हो जाएगा, व्हाइट कलर का कुछ हो जाता है, उसे हम बर्न्स बोलते हैं। अगर वो ज्यादा टाइम के लिए रहता है तो वो कुछ भी कॉज कर सकता है। मेरा एक केस भी था जिसको प्री कैंसरस लीशन हो गया था सिर्फ लौंग रखने की वजह से। वहां पे लौंग रखा रहता था, वहां पे बर्न हो गया कंटिन्यूअसली। कुछ अगर आपके दांत में वो गम्स में प्रॉब्लम करेगा तो वो प्री कैंसरस हो जाता है, फिर कैंसरस हो जाता है। तो लौंग को ज्यादा देर नहीं रखना चाहिए और ये सब सिर्फ टेम्पररी सोल्यूशंस है, ये कोई भी परमानेंट सोल्यूशन नहीं है। अगर आप दांत का वो रूट कॉज प्रॉब्लम नहीं ठीक कर रहे हैं तो कोई फायदा नहीं है लौंग के तेल का। वो हाँ, आपके दांतों को डेफिनेटली अच्छा करता है, बैक्टीरिया से बचा रहा है, बट नॉट इफ यू हैव पेन। इफ यू हैव पेन यू हैव टू गेट इट चेक। और अगर लॉन्ग टर्म में आप यूज कर रहे हैं तो उसको बहुत कम क्वांटिटी में रखना है, कम देर के लिए।
थैंक यू।
Interdental brush, I use twice a day only, a morning and night. Is that okay?
That is okay. Interdental brush is good enough, especially if you have crowding. So a lot of people have crowding in their teeth and normal toothbrush cannot clean. So interdental toothbrushes are very important. Next, if you have braces, anybody with braces, they should use interdental toothbrushes. So interdental toothbrushes twice is perfect, is well and good.
And if you keep using the battery brush, doesn't it take away the above coating of the tooth?
No. So that's what you should use it only for 2 minutes. Generally, all the battery toothbrushes, they come with a timer. If not, also the pressure is equally distributed. So when these battery, that's why these battery toothbrushes are preferred, because pressure is distributed. It gives a proper uniform pressure, so the layer does not come off. But obviously, if you keep going like this with your brush, even battery toothbrush, or if you're putting a lot of pressure, it will take it off. And for more than 2 minutes, it's not needed. It will cause more harm than good. So long brushing will not help. So battery toothbrushes don't do that. It's a myth, and they're in fact much better because they're scientifically created. They're not just created like that. So they're under researches, what time it should be, how much pressure, which motion it should go in. All these are researched, and then only these brushes are made. So they are all FDA ID approved brushes.
अच्छा एक चीज
Madam,
पूछनी
there are 3 types of brushes. These soft, medium, and hard.
When
So
I
generally
wanted to
they say that you have to use the soft one.
Yes.
What about the medium and hard? I mean, can you occasionally use it, or you should not touch it at all, or why do they make it in the first place? I mean, why do they manufacture the medium and hard ones in the first place?
Yeah. So generally, soft toothbrushes, every time I ask my patients, I ask them to touch it like this. If you're able to go down properly, fully, the brush is perfect for you. So soft brushes are much, much, much better. Some people, it is important to use medium and hard when they have lot of deposit. And if you don't have deposit, if you're cleaning your teeth properly, if you are getting scaling done every 6 months, you need only soft toothbrushes. But in studies, in scientific researches, it has been proven that medium brushes and hard brushes, they cause more loss of enamel, the top layer of the tooth, than any other brush over a long period of time. People are still using it because they think there's efficient cleaning happening, but this efficient cleaning is also removing the tooth. If you obviously have lot of deposit, if you're very prone to having deposits, then yes, these brushes are good. But generally, until your dentist doesn't say use this one, you should use soft bristle toothbrush.
अच्छा एक चीज पूछनी थी, दांत हिल रहा है तो नॉर्मली केस में गिर जाएगा, उस टाइम छोड़ना चाहिए कि निकलवा लेना चाहिए?
नहीं नहीं, अगर तो आप पहले अपने डेंटिस्ट के पास जाइए और देखिए कि दांत हिल क्यों रहा है. कई बार तो 3 टाइप के हिल मतलब लेवल्स होते हैं. एक अगर दांत सिर्फ 2 mm तक हिल रहा है, दूसरा अगर वो 4 mm तक हिल रहा है, और तीसरा वो 6 mm तक हिल रहा है. तो इसे हम ग्रेड 1, ग्रेड 2, ग्रेड 3 बोलते हैं. ग्रेड 3 में दांत निकलवा देते हैं, बाकी 2 में इन दांतों को बचाया जा सकता है. ग्रेड 1 में सिर्फ आप नॉर्मल स्केलिंग करवाएंगे तो वो आराम से रुका रहेगा वहीं पर. लेकिन अगर ग्रेड 2 है तो 2 चीजें हो सकती है. या तो आप दांत निकलवा सकते हैं, या एक वायर लगा के, अगर आपके सारे दांत है तो वायर लगा के उसे स्टेबल कर सकते हैं. और फिर पूरा क्लीन करके, वो जैसे प्लास्टर होता है हमारी 2 हड्डियों को जोड़ता है, वैसे ही ये दांत को भी जोड़ देगा पूंछ से. लेकिन अगर बहुत हिल रहा है, जैसे ग्रेड 3 हो गया 6 mm, उस समय दांत निकलवाना ही पड़ेगा क्योंकि वो बच नहीं सकता.
ठीक है, थैंक यू, थैंक यू.
Any questions left?
Madam, एक छोटा सा और सवाल था. How many days should we change the toothbrush?
हाँ, so every 3 months you should change your toothbrush. Every 3 months, क्योंकि उसके बाद उसमें बैक्टीरिया का फॉर्मेशन होने लगता है. आपके ब्रश के जो वो होते हैं ब्रिसल्स, वो खराब होने लगते हैं. हमें तब तक नहीं वेट करना चाहिए जब तक सब खराब हो गया हो, अब वो काम ही नहीं कर रहा है, वो दिखने में बड़ा सा वैसा हो गया है, तब नहीं. हर 3 महीने में बदलना चाहिए, क्योंकि कुछ चीजें हमें दिखती नहीं है बट हो रही होती है. तो ये जितना बैक्टीरिया, जर्म्स और ये जितने भी कीटाणु उसमें हो रहे हैं, वो हमें दिखते नहीं है बट वो हो रहे हैं. तो इसलिए हर 3 महीने हमें रिमूव करना चाहिए, चेंज.
हेलो
हाँ
मैडम, क्या क्या एक्सरसाइज कर सकते हैं हेल्दी टीथ के लिए?
हेल्दी टीथ के लिए तो एक तो होता है गम मसाज। तो आप अपनी उंगली लेके, तो जैसे ये गम है और ये दांत है, आप अपनी उंगली लेके ऐसे ऐसे अगर इसे गोल गोल मसाज करेंगे, इससे दो चीजें होती है। एक तो आपका दांत स्ट्रांग होता है, और जो गम और दांत के बीच में जगह है उससे एक फ्लूइड निकलता है, उसे हम जीसीएफ बोलते हैं। तो वो क्रेविकुलर फ्लूइड होता है, जिंजाइवल क्रेविकुलर फ्लूइड। वो आपके दांत को साफ करने लगता है। तो अगर आप ऐसे मसाज करेंगे, ये एक चीज है। अगर आपको अपने माउथ के लिए, मतलब पूरे मुंह के लिए वो करना है एक्सरसाइज, तो मुंह खोलना बंद करना 5 बार, ये बहुत हेल्पफुल होता है। तो ये, और फिर उसके बाद आपका ये जॉ है, इसे लेफ्ट राइट लेके जाना। ये सब आपके ना मूवमेंट को बहुत ही अच्छा रखेंगे। तो आप यहाँ पर अपना हाथ रख के भी देख सकते हैं कि वो मूव ठीक से हो रहा है या नहीं। अगर बहुत रुक रुक के हो रहा है तो फिर आपको ये और करना चाहिए, तभी वो थोड़ा फ्लेक्सिबल होगा उधर।
Anyone else want to ask anything? I guess सबके questions हो गए. अच्छा, I tend to get this masseter muscles development a lot. Is it again related to dental thing?
ओके, मसीटर मसल डेवलपमेंट, मसीटर होता है, सबके मसीटर है।
हाँ, वो ज्यादा डेवलप हो जाता है मेरा, सो
हाँ, तो वो ना ज्यादा खोलने से,
हाँ
हाँ,
हाँ, मुझे
ज्यादा
डॉक्टर
खोलने
ये
से
बोलती है,
और बंद करने।
तुम नींद में ऐसा गुस्सा करती हो कि दांत मैं
हाँ, तो वो मसीटर में बहुत होता है। तो
if I'm doing it during the sleep, because what happens, what you mentioned earlier, एक साइड से चबाते हैं, दूसरे साइड से चबाते हैं, so I these days I take care of it because मेरे राइट साइड पे, because वो शायद ऐसा होता है, we tend to use the right hand side, people
हाँ
ने बैलेंस करना शुरू किया है to chew it from both the sides,
हाँ,
तो मुझे
वेरी
intentionally
इंपॉर्टेंट।
लेफ्ट करना पड़ता है, राइट तो अपने आप ही हो जाता है। बट
हाँ,
इज इट मतलब अदरवाइज कोई वो नहीं है ना, इफ ओनली द मसल गेट्स डेवलप्ड एंड ऑल दैट, सो
तो दो चीजें हैं। एक तो अगर आपको दांत में ऐसे करने की प्रॉब्लम है, क्लेंच करने की, इसे हम ब्रक्सिज्म बोलते हैं, बहुत लोगों को प्रॉब्लम होती है, इट्स वेरी कॉमन। तो इसके लिए हम लोग नाइट गार्ड्स यूज करते हैं। तो नाइट गार्ड बेसिकली आपको पहनना होता है ताकि आपके जो दो दांत है वो ऐसे ऐसे घिस घिस के पूरे घिस ना जाए। तो वो इम्पोर्टेंट होता है, तो वो रात में आपके दांतों को प्रोटेक्टेड रखेगा। और मसीटर दो चीजों से होता है, एक तो मुंह बहुत खोलने से या बहुत मूवमेंट से, सडन मूवमेंट, तो तब हम लोग का मसीटर इफेक्ट होता है। तो इसका एक ही सोल्यूशन है कि आप एक नाइट गार्ड लगा लीजिए, कोई ज्यादा प्रॉब्लम नहीं होगी, बट ओवर अ पीरियड ऑफ टाइम, मतलब लेट्स से आफ्टर 10-15 years दर्द होने लगेगा, जॉइंट में दर्द होने लगेगा, जॉइंट में दर्द शुरू हुआ, नेक्स्ट हेडेक शुरू हो जाएगा। इसीलिए नाइट गार्ड इम्पोर्टेंट है। नाइट गार्ड इररिस्पेक्टिव ऑफ ब्रक्सिज्म हो या ना हो, हम लोग ऐसे ही बोलते हैं कि आप पहन लीजिए, आपके लिए ही बेटर है, और ये आपके दांतों को भी एक पोजीशन में ही रखता है। तो इट इज वेरी गुड, बट अगेन उसमें एक ही डिसएडवांटेज है कि आपको सुबह निकाल के उसे अच्छे से साफ करना पड़ेगा और रखना पड़ेगा, आप गंदी चीज वापस नहीं पहन सकते हो। तो वो एक है।
Ma'am, what is the maintain advice on maintenance of tongue hygiene? I mean, tongue भी हम वैसे ही साफ कर लेते हैं जैसे ही ब्रश करते हैं, तो उसका क्या है मतलब? What is the instruction?
तो टंग क्लीनर इज नॉट समथिंग प्रिस्क्राइब बाय डेंटिस्ट जनरली, क्योंकि उससे क्या होता है, लोग ठीक से यूज नहीं करते हैं और जो टेस्ट बड्स है वो डैमेज होने लगते हैं। तो टंग हाइजीन का बहुत सिंपल है, आप अपना टूथब्रश लीजिए और उसे 1-2 बार ऐसी वहां पे अच्छे से साफ कर लीजिए, उतना काफी है, क्योंकि टंग में सेल्फ क्लेंजिंग प्रॉपर्टी भी होती है। तो जितने भी टेस्ट बड्स के नीचे वाले एरिया है, तो अगर हम लोग माइक्रोस्कोपिक में देखें तो वो खुद ही अपने आप को साफ करने लगते हैं। आप अगर लग रहा है कि आपको कि हाँ बहुत डीप है, मेरे को अब कुछ कुछ हो रहा है उधर, अच्छा नहीं लग रहा है, तो बस टूथब्रश लेके हल्का सा उसे साफ कर लीजिए। टंग क्लीनर मैं कभी अपने पेशेंट्स को नहीं प्रिस्क्राइब करती, क्योंकि बहुत लोग गलत तरीके से यूज करते हैं, उसे यूज करना बहुत आसान तो है, तो आप अपने ब्रश से ही कर सकते हैं साफ।
मैम एक और चीज है, सी समटाइम्स व्हेन यू आर सिक और व्हेन यू आई डोंट नो, जब आपके कुछ पेट के कुछ इश्यूज होते हैं तो आपके टंग में कोटिंग ज्यादा होता है या जो भी है वो क्या है, मतलब उसका व्हाट इज द लॉजिक ऑफ दैट एंड इज इट ट्रू एंड हाउ डज द टंग रिफ्लेक्ट द हेल्थ ऑफ द आई मीन बॉडी इन सच एज सच?
Tongue is a huge place where the entire body's health is reflected. तो जब हम लोगों के स्टमक इश्यूज होते हैं या हम लोगों के कोई भी ईसोफेगस में या इंटेस्टाइन तक लेकर, मतलब यहाँ गले से लेके इंटेस्टाइन तक कोई भी इशू होता है तो वो टंग में लेयर फॉर्म हो जाती है। वो लेयर बैक्टीरियल लेयर होती है। एक क्यों वो फॉर्म होती है? क्योंकि आपका जो सलाइवा है वो सेक्रीट होना कम हो जाता है। तो जब सलाइवा सेक्रीशन कम हो जाता है तो वहां पे बैक्टीरिया को जगह मिल जाती है फॉर्म करने की। जैसे मैंने अभी बोला था सेल्फ क्लेंजिंग प्रॉपर्टी वो सलाइवा की वजह से ही होती है, लेकिन अगर वो सलाइवा ही कम हो गया तो उस पर वो लेयर फॉर्म हो जाएगी। तो इसीलिए वो होता है। उससे दो चीजें होती है, आपको बहुत फाउल स्मेल शुरू हो जाती है जिसे हम हैलिटोसिस बोलते हैं, मतलब गंदी स्मेल आ रही है, बहुत स्टिंकी स्टिंकी सा लग रहा है। वो क्योंकि आपके पूरे स्टमक इश्यूज में है। वो डेंटिस्ट आपका सॉल्व नहीं कर सकता, उसके लिए आपको जाके एक जनरल फिजिशियन को ही दिखाना पड़ेगा या गैस्ट्रोएंटरोलॉजिस्ट को दिखाना पड़ेगा। तो वो होता है। लेकिन क्या रीजनिंग है? वो इसलिए क्योंकि सलाइवा कम हो जाता है, बैक्टीरिया की लेयर फॉर्म हो जाती है। बट वो व्हाइट पैच अगर हो रहा है, जनरली वो बहुत सारी चीज हो सकती है। फंगल इन्फेक्शन भी हो सकता है जिसे हम कैंडिडियासिस बोलते हैं, बहुत कॉमन है। कैंडिडा हमारे माउथ में हर समय अभी भी है। जैसी आपकी इम्यूनिटी कम होती है वो अपॉर्चुनिस्टिक इन्फेक्शन होता है। इम्यूनिटी कम हुई, उसे मौका दिखा, वो आके स्प्रेड हो जाता है। तो ये बहुत कॉमन है कैंडिडा। तो जब भी आपकी इम्यूनिटी कम हो रही है तो मतलब कैंडिडा आपको दिखने लगेगा, तो आपको पता चल जाएगा कि अच्छा अब मेरी इम्यूनिटी भी कम हो रही है। अगर बहुत शाइनी टंग है तो आपको कोई भी ब्लड डिसऑर्डर हो सकता है, तो वो भी है। तो ऐसे बहुत टाइप की टंग्स हैं। ज्योग्राफिकल टंग हो गई, उसमें भी पैटर्न ऑफ हो जाता है। तो ऐसे बहुत टाइप के, तो टंग हम लोग के बहुत सिग्निफिकेंट होती है। टंग, चीक्स और गम्स, और ये सब हमें बताता है कि पूरी बॉडी में क्या हो रहा है। दांत में अगर दांत कम हो रहे हैं, क्यों हो रहे हैं? एसिड की वजह से भी हो सकते हैं, वो एसिड आपके पेट से भी आ सकता है। तो वो सब, तो पूरा माउथ हम लोग के लिए बहुत सिग्निफिकेंट है ओरल के लिए। इनफैक्ट अगर आप एक्सरे देखेंगे, एक्सरे देख के भी हम लोग कुछ चीजें बता सकते हैं। एक्सरे में अगर आपके दांत के बीच में एक स्टोन टाइप का है, मतलब आपके किडनी प्रॉब्लम है, वो भी है। अगर आपके येलोइश है तो लिवर प्रॉब्लम है। तो ये सब भी हम लोग देख के बताते हैं।
So is tongue cleaner good to do? I mean, I always do it. You said nail.
I don't recommend my patients tongue cleaner because they don't do it properly. Number one. Number two,
What
dental.
is the proper way of doing it? Do you have a tongue cleaner with you at the moment? You can show us.
No, because I don't actually use it, and neither I prescribe my patients. I always tell them to use a normal brush in the like on their tongue just to clean it. What happens with tongue cleaner is that none of the dental associations actually recommend a tongue cleaner. They don't recommend tongue cleaner. Why? Because your tongue has self-cleansing property because of saliva. If your saliva is low, that is because of some other cause, and we need to find that cause. So tongue cleaner, yes, you can use it, just don't be very harsh on your tongue. But again, it can damage your taste buds. So that way we have to be very careful. That is why tongue cleaners are not advertised also that much. Because
so you just take your toothbrush back and forth? Is that
yeah,
what you
that's more than enough. And it should be soft toothbrush, not hard toothbrush. You cannot damage your tongue. Soft toothbrush, back and forth, it's more than enough.
Yeah, they should only market soft toothbrush. I don't know why they have the other ones.
Yeah, it's actually none of the dentists recommend unless and until you have a lot of deposits. Only if you have a lot of deposits, we say go for a medium or hard toothbrush. But for anybody and everybody, soft toothbrush is the best.
Hello.
Yes, sir.
मैडम, गवर्नमेंट ऐसा कुछ अवेयरनेस के करती है टूथ की हेल्थ के लिए? ऐसे कुछ ऑर्गेनाइजेशन है?
हाँ, तो हर एक सिटी में आईडीए है। आईडीए है इंडियन डेंटल एसोसिएशन। तो इंडियन डेंटल एसोसिएशन कंट्री में भी है, हर स्टेट में भी है, हर सिटी में भी है, हर डिस्ट्रिक्ट में भी है। तो ये लोग ऑन एंड ऑफ अवेयरनेस कैंप्स क्रिएट करते हैं। दूसरा जो करते हैं वो सारे कॉलेजेस करते हैं, जितने भी डेंटल कॉलेजेस हैं। तो डेंटल कॉलेजेस क्यों करते हैं? क्योंकि गवर्नमेंट ने ये एडवाइजरी निकाली है कि आपको रूरल एरिया में जाके अवेयरनेस क्रिएट करनी है। तो हर एक स्टूडेंट जो है उसे एटलीस्ट एक कोटा दिया जाता है, उसे अवेयरनेस क्रिएट करनी होती है विद द होल पर्पस ऑफ कि अवेयरनेस जो नॉर्मल लोग हैं उनमें क्रिएट हो। बट हम लोग की थोड़ा सा इतना स्ट्रॉन्ग नहीं है, इसीलिए अवेयरनेस इतनी स्ट्रॉन्ग नहीं चल रही है। वी शुड वर्क ऑन दिस मोर। ऑब्वियसली गवर्नमेंट को और इसमें देखना पड़ेगा, एंड आईडिया इज कंटिन्यूसली फाइटिंग फॉर इट ऑल्सो। तो आईडिया हम लोग को बताती रहती है। सो एंड एवरी डेंटिस्ट इज पार्ट ऑफ आईडिया। So we do a lot of camps. In fact, even I do a lot of camps. I go to schools and I create awareness among children, so which we do often, especially oral health days पे और ये सब कुछ पे हम लोग promote करने की कोशिश करते हैं, but it has to be more effective. लोग इतना लेते नहीं, बहुत लोगों का स्टिग्मा भी है. तो कुछ कॉलेजेस में किसी की डेथ डेंटल ट्रीटमेंट के बाद उन्हें लगता है ये तो डेंटल ट्रीटमेंट की वजह से हुई है, कोई ये नहीं देखेगा कि और कोई कॉज है उसमें. तो ये भी होता है. तो इसीलिए लोग प्रेफर भी नहीं करते. हम लोग खुद ही इतना केयर नहीं करते अपने दांतों के बारे में. बहुत लोग, हम लोग को वही मैं जैसे बोल रही थी, आप लोग कितनी बार खुद डेंटिस्ट के पास गए हैं, वही एक सवाल है जो हम लोग वी शुड बी आंसरिंग आवरसेल्व्स. व्हाई डोंट वी गो टू अ डेंटिस्ट? even though we know it's important, even though we know our hygiene, oral hygiene is very important, we still don't. तो हमें पहले खुद से शुरू करना पड़ेगा. And the whole point of having health day is to create awareness.
Right.
Health day or general health day or world health day, or the whole point of it is to raise awareness.
Anyone else is having question? I know we are. मुझे ऐसा लग रहा है जितना लंबा सेशन था उतना ही question answer. But see, this when I introduced you, you said कि हाँ, that was too so much. In the whole introduction, the main part was spreading awareness and giving information, and see how much awareness and it's the need of information is still, like you shared so much. Like I mentioned that, कितना कुछ था, and I was like, ये भी नहीं पता, ये भी, and still we were having so many questions.
Yeah.
So
That happens,
that's
yeah.
why I really want to thank you. It was a very impressive and very informative, more importantly, session. And rest, whosoever is having any questions, मुझे पता है अभी सब लोग बैठकर सोचेंगे और बहुत सारी चीजें आएंगी. You can share all that in the WhatsApp group, and I request Krishanga, please take out time and answer those queries. And I'll request Shabana ji
One
and
question, Sonal, one question. I mean,
Yeah,
is it some people brush even after lunch?
No, that is not needed. You should brush only twice a day, not more than that. After lunch, you should gargle your mouth. In fact, after every meal, take water,
Gargle or rinse your mouth?
Both you can do. Okay, so gargling is, it'll clean till here. Okay, and when you swish it around, let's say that you are at someone's place, then you can just swish it around. If you are at home, gargle. It's always better to gargle. So obviously gargling, you have to rinse your mouth as well, both. So but not necessarily you have to put salt, pepper to gargle, just with normal water, because we want even your tonsil area to be clean. A lot of people get tonsil stones. A lot of people get tonsillitis. That's because of bacterial infection. So that's why gargling is important. Rinsing is equally important. So when you gargle, you have to rinse. And if you are, at someone's place, just rinse it around and take it. More than enough. Swishing it around is more than enough. But do it. But brushing after, lunch is not needed at all. It will only do more damage, than good. So there's no point of doing more harm than good.
Hello.
Yes, sir.
मैडम, मेल के टीथ ज्यादा स्ट्रांग होते हैं फीमेल के?
मिल्क के
मेल और फीमेल
मेल के नहीं, एक्चुअली वैसा होता नहीं है. तो हमारे क्या होता है, मैं आपको बताती हूँ, ये एक्चुअली काफी इंटरेस्टिंग भी है. तो हमारे जो दांत है वो या तो हमारी मम्मी से आ सकते हैं या हमारे पापा से आ सकते हैं. तो अगर आप बोलेंगे कि मेल के टीथ ज्यादा स्ट्रांग है, मेरे को पता है कि मेरे दांत मेरे पापा से आए, लेकिन मेरा जो जॉ है वो मेरी मम्मी का है. तो ऐसे ही आप बोल नहीं सकते कि मेल के टीथ ज्यादा स्ट्रांग है, फीमेल के टीथ ज्यादा स्ट्रांग है. बट हाँ, अगर आप एरिया वाइज देखिए, जनरली मेल का जॉ एरिया ज्यादा होता है, तो उनका जॉ स्ट्रॉन्गर होता है. बट दांत सबका ऑलमोस्ट इक्वली होता है. वो आपके कितना पता है, उसमें बहुत फैक्टर्स हो जाते हैं. फिर हाउ मच कैल्शियम आपने इनटेक किया है बर्थ से पहले, बर्थ के समय जब टीथ फॉर्म हो रहे थे तब. फ्लोरोसिस, आपके पानी में कितना फ्लूराइड था, दैट कंटेंट ऑल्सो मैटर्स. दैट कंटेंट मैटर्स अ लॉट इन फैक्ट. तो अगर फ्लूराइड बहुत ज्यादा हो गया, यू विल हैव समथिंग नोन एज फ्लूरोसिस. फ्लूरोसिस है तो आपका दांत ब्रिटल हो जाएगा, बट यू नेवर गेट केरीज, आपको कैविटी नहीं होगी अगर फ्लूरोसिस है. तो अगर ऑप्टिमम अमाउंट ऑफ फ्लोराइड था तो योर टीथ वुड बी स्ट्रॉन्ग एंड इट विल आल्सो प्रोटेक्ट यू फ्रॉम कैविटी. तो ये भी है, हमारे सारे पानी में देयर इज फ्लोराइड. and it is government regulation कि आपको fluoride add करना है. Why? Because of dental caries. No other reason, just because of dental caries, they add fluoride in our water.
Okay. Thank you so much, Krishanga, and thank you everyone who has attended the session. I'm sure that सबको बहुत सारे question के answers मिल गए होंगे. Rest, whatever comes to your mind, please share in the group. And I think we are already ahead of our time. Thank you so much.